This recording will go over drugs to improve peripheral blood flow. A common problem in older adults is peripheral arterial disease, which is characterized by numbness and coolness of the extremities, claudication, which is pain and weakness of a limb when walking but no symptoms at rest, and possible leg ulcers. The primary cause is arteriosclerosis and hyperlipidemia, resulting in atherosclerosis, after which the arteries become occluded. Peripheral vasodilators increase blood flow to the extremities. They are used in peripheral vascular disorders of venous and arterial vessels. They are more effective for disorders that result from vasospasm, such as Raynaud's disease, than from vessel occlusion or arteriosclerosis. In Raynaud's disease, cold exposure and emotional upset can trigger vasospasm of the toes and fingers. These patients have benefited from vasodilators. Individuals with PAD who are treated with statins for dyslipidemia may see an improvement in intermittent claudication symptoms as well as a decrease in serum lipids. Also, patients with PAD who are hypertensive see improvement for both conditions when taking the antihypertensive drug Ramipril, an ACE inhibitor. The alpha blocker prazosin and the calcium channel blocker nifedipine have been used as peripheral vasodilators. The antiplatelet drugs clopidogrel and aspirin have been used to decrease PAD symptoms. Another antiplatelet drug, Cilostazol, has been approved by the U.S. FDA for treating intermittent claudication. It decreases arterial thrombi. Cilostazol is an antiplatelet that has a dual purpose of inhibiting platelet aggregation as well as causing vasodilation to treat intermittent claudication. Again, intermittent claudication is when the patient experiences pain with walking but does not experience any sort of symptoms at rest. Side effects include dizziness, headache, peripheral edema, GI distress, tachycardia, palpitation, dysrhythmias, and blood dyscrasias. In regards to teach the patient that grapefruit and green tea will increase levels of cilostazol. Also, taking with ginger and ginkgo biloba may prolong bleeding time. St. John's wort will decrease the effect of the medication. Pentoxifylline is a hemorrhagic agent or a blood viscosity reducer agent that helps to increase blood flow through peripheral vessels. It improves microcirculation and tissue perfusion by decreasing blood viscosity and improving the flexibility of erythrocytes, thus increasing tissue oxygenation. It inhibits aggregation of platelets and red blood cells, and because it decreases blood viscosity, it helps to increase flow through peripheral vessels. Reactions to an overdose of pentoxifylline include tachycardia, areflexia, and GI bleeding. The drug should be taken with food, and the patient should avoid smoking because nicotine increases vasoconstriction. Patients taking an antihypertensive drug along with pentoxifylline may need to have the antihypertensive dosage decreased to avoid side effects. Please review the purple nursing process box on cilostazol on your own. Go ahead and pause the video to read the questions and choose your answer, and then resume the video to see if you're correct. For question 1, the correct answer is B as in boy. For question 2, the correct answer is C. For question 3, the correct answer is C. For question 4, the correct answer is A. And for question 5, the correct answer is D as in dog.